We have a very special guest, Therese Johnson of Senior Care of Sacramento, and she's going to share with you some very, very interesting and special techniques that have helped her deal with her clients and the people that she helps during the placement process. And of course, Therese is a specialist and the owner of Senior Care of Sacramento. And so, Therese, I'd like to go ahead and have you come on and just educate us on some of the things that we can do to really help people, but also what you also have done in working with your clients. Therese Johnson.
Hi, Jim. Thank you, and thank you for having Senior Moments on the Rush Hour. I really liked what Terry was talking about, the Reiki energy last week, Reiki Energy Touch, and so I thought I'd like to talk about it today regarding the benefits Reiki can have for seniors and their caregivers. It doesn't so much deal with the placement process, but it is really a great practice for health and well-being. And as Cammie was talking about last week. So I happen to be a Reiki master myself, as she mentioned, and I've been practicing and teaching it for 20 years now. Jim, do you know what it's most famous for?
I would say probably grounding.
Actually, no. It's most famous for creating pain relief. And it's used mainly at hospice and cancer clinics across the country.
Wow.
In fact, some insurance companies in the Midwest are also paying for treatments. You'd think we would be out here in California. We'd like to think of ourselves in California as very progressive, but we're not doing it out here yet. But hopefully soon we will be. A lot of clinical studies also have been done on Reiki, proving that Reiki, if it's used before, during, and after surgery, that it speeds recovery by almost 50%.
That's pretty phenomenal. Real quick, any comments on that, Cammie, from what you've read about Reiki?
Absolutely. I can believe that. That makes perfect sense to me because it is about helping the person break, it's about those channels that get blocked or weakened, where the energy flows through your body. So when you have surgery, there are certain things that happen in the trauma of that surgery that would need to have some sort of energy pulse to get things moving back and get them all healed. And I could see that would really help someone recover more quickly from a surgery.
Yeah, please tell us a little bit more, Therese, and just educate us a little bit more about Reiki.
Yes, as a volunteer for Sutter Hospice for over 7 years, I've given many Reiki treatments to patients over the years. And so I know firsthand a lot of the results, and I have had some amazing results with many of my Reiki clients. I'd like to share a couple of those with you. In my early years when I first started practicing, one of the most exciting ones that I had was one of my students, actually. She was pregnant and she had a baby that was born with birth palsy, and one arm was paralyzed, and they said that the baby was going to have like 6 to 8 different surgeries, and they couldn't guarantee that the baby would ever get feeling back in the arm. And after 6 Reiki treatments, the baby had complete feeling back and complete range of motion in the baby's arm and never had to have one surgery.
That is awesome. So, wow.
Yeah, and that really got me on fire with it, and that was really exciting. I said, wow, this is pretty amazing. Yeah. And so another one of my clients had a brain tumor, the kind that Kennedy had, that he died of, and he had this cancerous brain tumor. He was one of the few survivors, and he spent 5 years going through all the radiation and the chemo to get rid of it because it was inoperable. And as a result of all the chemo and the radiation, it gave him a side effect of seizures all over one side of his body and in his brain. And so he was miserable, and he came to me for Reiki to try and get rid of the seizures. And I could feel them when I was working on him. But after treatment, they would go away, and he would have relief from them for like up to 2 days. So he would come back every 2 days, and then each time I gave him a treatment, then it would last, the pain relief, and the seizure would go away for up to 3 days, and then it was 4 days. And so it would get further and further out. Then it was a week, and then 1 month. He'd only have to come once a month. And after 6 months, they were completely gone, and he got rid of the seizures completely. So that was another really awesome result that I had from one of my clients. But what I really wanted to talk about was the effect of Reiki on dementia patients. because when I had my care home in the 90s, I started using Reiki for my dementia patients, and I noticed that it was very helpful, especially because with dementia there's a lot of behavioral issues that come with that disease. Unfortunately, a lot of dementia patients have wandering issues where they want to take off even though they don't really know where they're going, or they're paranoid. They would be accusing my staff or the other residents of stealing from them, even if it was just like, toothpaste. And so it could make it very uncomfortable for everyone in the house. And the Reiki was very effective in eliminating some of those behavioral problems. After treating some of my patients that had these behaviors, those behaviors were eliminated. We were able to eliminate wandering, which was awesome because, you can only distract somebody from taking off with ice cream so many times. You know what I mean?
Yeah, Cammie takes off with ice cream all the time, especially if I have mine. It's like, where did that ice cream go? No, that's pretty incredible, Therese. Now, we just have a minute here. I want to make sure people know. I know you have some also published articles on this topic. Can you give us a website for that?
Yeah, actually, it's on the internationalreiki.org website, or if you go to my website, Senior Care of Sacramento, it's also on there under articles that I've published. There's one on Reiki and hospice, one on treating Alzheimer's with Reiki, and there's several others, so you can find them there. But it's a great method for creating harmony in the care homes, and it's also very good for caregivers to use on themselves. It's great for reducing anxiety and eliminating those behavioral issues like I was talking about.
Great. Well, thank you. And that's Therese Johnson from Senior Care of Sacramento. You can reach her at seniorcareofsacramento.com. And so we appreciate so much the information that you gave us.
Ask for help. You're not alone. We can help. We can give you a peace of mind. We care. Saving seniors, savings.
Well, we help seniors find caregiving services for in-home, board and care, or assisted living in the geographical location they're looking for, in the budget that they have, and based on their needs, if they have dementia, if they're diabetic, or if they just need housekeeping or medication management.
Savings.
Contact us at seniorcareofsacramento.com.